Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing selling opportunities using election periods, special election periods designated by CMS that give us an opportunity to market Medicare Advantage and PDP programs year-round. We'll discuss the difference between MA and Med Sup selling opportunities to a brief detail as well, but we wanted to make certain that we go through the special election periods to give you some semblance of the breadth of opportunity that remains year-round in the Medicare Advantage and PDP space that we have available to us. Today's presentation is being recorded, and the recording link, and much of the data that we reference throughout the course of the presentation will be sent to all who have RSVP'd to today's presentation. So obviously, that includes all of you who are on the presentation at the moment. One of the things that we'll ask you to do, since we have challenges with feedback and some of the other things with electronic means, is that you make use of the question box in the software. Many of the questions may well be answered throughout the course of the presentation, but we'll address those remaining at the end of the presentation to make certain that we cover everything that's necessary. It's also important to note that if there's something that comes up that we don't know, we'll make certain that we research it and get you that answer as well. There are a ton of slides in today's presentation, but some of them we'll go through very, very briefly. And in certain selling opportunities, we have full-blown presentations dedicated just to that particular SEP or product, and we will make certain that links to those previously recorded presentations are made available to you in the follow-up as well. A bit of information about our organization for those that aren't familiar. We are a national marketing organization founded in 1968. We're part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler, providing insurance product to the public through independent insurance agents such as yourself. And we have contracts for products available at the highest possible commission levels, with recruiting contracts available to those who qualify. As I mentioned, we were founded in 1968, so that means we recently celebrated our 50th anniversary, which we feel is quite a milestone for what started as a small family agency in rural Nebraska that's grown into one of the largest marketing organizations of its type in the country in the Medicare and ancillary space. We do so through a full portfolio of products that include choices in the Medicare arena, including the Medicare Advantage and Medicare Supplement plans and the standalone Part D prescription drug programs. But we also offer a full portfolio of life insurance and annuity products, final expense life insurance and pre-need plans, long and short-term care programs, disability income offerings, and of course the ancillary benefit programs such as dental, vision, hearing, critical illness, cancer, and hospital indemnity. That Medicare Advantage portfolio includes all the large national carriers and many of the smaller regional carriers that can make a difference for you in your market. And that same philosophy carries over into the PDP space, where those national carriers are available to you through our organization. Our Medicare Supplement portfolio is very large and robust and includes support programs that help you be successful in that space as well. There are a couple of fairly new hot offerings in this area, so please make certain that you are open to the communications that come out regarding the Ascendo and Humana Achieve programs as well, in addition to all the other fine offerings that are there. In the ancillary space, in each of the categories, you have the national leaders available to you. These make for great door openers, additional revenue streams for your agency, but more importantly, cover needs for your prospects and clients that the base medical programs do not necessarily address. When we look at the Medicare market itself, you don't come on a program like today without people speaking to you of the silver tsunami, the aging of the baby boomers, 10,000 people a month turning 65, one every 10 seconds. But if you look at this based just on age, you're not getting an accurate picture of the overall opportunity, because there are some folks who turn 65 and don't access Medicare benefits immediately, But then again, there's about 1/6 of the Medicare population that's under the age of 65, a huge portion of the population that needs our help, and many of these folks are especially affected by the special election periods as well. It's a diverse population, so we need a diverse portfolio of product to address the needs of our folks, because many of them have health issues. 2/3 of them have 3+ chronic conditions they're addressing, and they are sometimes a bit handicapped when it comes to their income and savings as well. So that lends to the use of different special election periods as well. When you look at the need that comes as part of this population and is addressed by many of the SEPs, we see that it has a very large effect on many of these individuals that don't have some of the financial resources some of the other folks have. Because the folks, when they join or enter into Medicare, they have many choices. And to be honest, one of the first ones is, what all parts of Medicare do they want to access? Do they want to add the optional Part B? Most do, but they don't have to. Are they going to pick up just drug coverage? Or are they going to look to not self-insure for the medical expenses, but look to get help with those through Medigap plans, the standardized, modernized Medicare supplement programs, or access additional help through the Medicare Advantage programs? Because we see, as people do enter into Medicare, they have, pardon me for those pop-ups, they have a pretty even split on their initial foray into Medicare between Medicare Advantage and Medicare Supplements. Because of the size of the population, that's a huge opportunity. And there is, of course, a portion that show only original Medicare only, but that may not mean that's their only coverages. They may have retirement coverage. They may have additional help through other assistance programs, like retiree plans or Medicaid assistance. So we need to know where these folks are and how we can help them and how we can do that year-round. Hence the emphasis that we have on special election periods, because the majority of people who are in Medicare will qualify for a special election period. It's just a question if exercising that SEP is in their best interest. Sometimes, too, it helps to have a translator for the terms, the acronyms that are part of the Medicare world, and we'll provide that to you as part of the follow-up to today's presentation as well. When we look at the different election periods, we're looking at an opportunity in the Medicare market that's split basically into two categories. You have the folks who continue on with traditional Medicare with the Parts A and B, and adding to that with ancillary programs or additional coverages to help take care of what original Medicare doesn't. And then you have the folks that enter into the Medicare Advantage and add prescription drug plans to the traditional portion as well. These give us different opportunities because they have differences that are important as to how we market. The Medicare Advantage programs are subject to different oversight than the traditional Medicare supplement programs, and it makes a difference for us when we look at the product offerings and when we can help individuals. Many times if someone's new to Medicare or things of that circumstance, the categories blend, but there are other enrollment periods we need to be aware of. And then, of course, licensing and certification will vary between the two options, where much of the original Medicare opportunities are not requiring you to do additional certification or licensing. You don't have to do additional licensing in most areas for Medicare Advantage or PDP either, but you are required to complete annual certification. And believe it or not, the first of those certification programs, the AHIP certification, actually comes available next Monday on the 22nd. Whether you'll want to take advantage of it immediately or work through one of the carriers that you're contracted with to get additional discounts on the cost of those services is something that we're kicking out additional information on as well. When we look at the standard election periods, of course, we've got the free-for-all, in a manner of speaking, the annual election period from October 15th through the 7th of December, then a non-renewal SEP period from December 8th through the remainder of February. And then we have the OEP that is recently been completed through the first quarter of the year as well. But then there are a ton of different special election periods, one of which addresses the most highly rated MA and PDP programs, the 5-star SEP, and then you have the SEPs that are designated to help the folks that are of limited income and assets. And then, of course, you got a ton of the other SEPs that we're going to talk about in detail. Here's 20 of the standard SEPs. And if you look at these as we go through them, some of them will have special pertinence to our current situation because of the world we see now with COVID-19, social distancing, and how that's affected employment even of the older Americans who now have lost jobs and are looking for help within the coverages that they have available. And this is many times when someone is in a distressed economic state, that gives us a ton of opportunity in the Medicare Advantage world. So you have within this area, the first two are very pertinent to that situation where you've had creditable coverage or you lose that coverage through no fault of your own. Common situation we're seeing with people who have been laid off. And then, of course, the folks that are changing employer or union coverage through either current or past employment. Some of the changes will be brought about as to how the different companies folks have worked for, who they're offering benefits to as well. And that's something that give us a long-term opportunity to help people, because the recovery within our economy, well, no one knows how it's actually going to work, but most are predicting that it's going to be a little slower. And if you have some folks in the Medicare space that have been thinking of retirement anyway, this might have been just the thing that nudged them over the edge. You also then have the folks that are institutionalized. That's not as large of a marketing opportunity in the Medicare Advantage space, even though there are I-SNPs. We'll talk about those later in the program. There are, however, many of these institutions, nursing homes, that have the folks that live there granting the administrator power of attorney to work with different PDP programs to help them with their circumstance. Many times the power of attorney in that circumstance will limit that to certain programs, but it's important to note that many of the folks that are in an institution may be getting Medicaid assistance. So the standardized low-income subsidy extra help programs will also standardize much of the payment that's necessary. It's then a question of addressing the needs of that population and the particular drugs that they are accessing. That does apply also to the folks that are in a state pharmaceutical assistance program. It's not a huge part of the population, but that's something to be aware of. And then, of course, the MSP programs, which have the ability to positively influence the economic status of the folks we deal with, the MSPs. We're going to address that in greater detail in a little bit as well. Gaining or losing that coverage comes as part of it. And then, of course, the trial SEP. Disenrolling from the first Medicare Advantage plan gives us an opportunity to take a person back to traditional Medicare and pick up a PDP program. Also, something that we don't run across as often or not, but something to be aware of, are the programs of all-inclusive care for the elderly. You don't see that nearly as much as you would some others, but that's important to note. And then, of course, the folks that move from one service area to another. So this is saying you move permanently, change your home address, but that doesn't mean moving 2 blocks down qualifies you for this special election period. It's moving from one service area to another that engages this particular SEP. There are obviously folks that have had challenges with Medicare eligibility issues. These are folks that are perhaps not aware of the time limits on enrolling in certain types of coverage, and this comes into play, and this addresses our need to make certain we know how to handle that. There's some help for you there. There is also, of course, the, pardon me. Trying to make this cleaner. I need to reset that setting. These are some folks that give us the opportunity to work with special needs programs, whether they're now eligible or have lost eligibility. We're going to talk about those as well, in addition to the passive enrollment into Part D or DSNP programs. Those come up a little bit as well. There's also the problem that some folks have with contract violations or enrollment errors. It's generally not the agent who's done that comes across that. Occasionally they do, but many times we'll have agents that will speak to other agents' challenges in enrollment or some of the things they may have done, finger quotes, working wrong. You'll run across those on occasion as well. You do find occasionally that a plan will no longer offer its coverage. They take themselves out of the market. You don't see that very often in the MA space, but it's something to be aware of, and it generally comes with a great bit of brouhaha, and you'll know about it when it comes about. Disenrolling during the OEP, well, that's something that happens just in the first 3 months of the year, and since we're in July, we're not going to spend a whole lot of time on OEP. And there may be some folks that qualify for the initial enrollment period, Part D, when they turn 65, or want to take advantage of the 5-star enrollment program, the SEP there, to take advantage of high-performing programs. The challenge is those 5-star plans aren't all over the country, so it's important to know where they're available. We've done a recent webinar on that, and you will have access to that recording as well. And then, of course, if plans don't perform well, we speak of how the star ratings have affected many of the programs and how the vast majority of folks have access to 4-star and up plans all across the country. There are a number of low-performing programs that if their star rating is not where it needs to be for 3 consecutive years, the CMS can eliminate that program. So that's important to note. One of the challenges that many folks have with a Medicare Advantage program is the fact that they are network bound, and there is a SEP now that enables an individual who has been part of a Medicare Advantage plan that's terminated a significant amount of their network providers to have an opportunity to change programs. And then there's the old catch-all. You experience an exceptional circumstance. What is that? Well, that's detailed in information that's sent to CMS to help them qualify for that, but a bit of a catch-all that, well, you need to be careful on how you use it. And then, of course, because of our current circumstance, the government has allowed a SEP code under the FEMA special election period that enables people who meet certain qualifications to qualify for this SEP. There was a lot of back and forth with communications between CMS and the carriers coming out, kicked out information, they retracted it, and then finally, first part of May, they came out with a SEP that allows eligible individuals to enroll in, disenroll from, or switch plans in all states, all tribes, territories, and DC, that is available to these folks retroly to the 1st of March and ending the end of June. We'll see if that's extended now that some things have opened up and we've seen a second wave of the pandemic, but at current circumstances, that's available through the end of June. The challenge is that this is available to the folks who didn't enroll or make a change during other enrollment periods. So it is a true SEP, and it is something that had to come about because of other opportunities that they weren't able to take advantage of because of the social isolation. It's additionally important that we need to know what we can and cannot do with this SEP. So if your customer wants to enroll due to this situation, we need to make certain that the customer has met the 3 prerequisites that we had talked about before, and that we work through this on a awareness basis. So we are following all the rules and making certain that this is not a mindset of, wow, it's Katie bar the door, it's a brand new way to massively market to get new business. So there's also a SEP that is recently passed the end of it, but it's important to note that there was a special enrollment period granted to individuals who were also affected by the different weather circumstances throughout the country that gave them an opportunity to extend some of their changes made available to them as well. Most of the carriers will give you some really tremendous election assistance. They'll give you the guides, such as this one featured by United Healthcare, but each of the carriers have these. Many of them are only made available electronically because of all the material that's part of it, but it's a very important document to be aware of and to make use of and to do a little bit of studying on as well, because it helps you understand the possibilities for a particular program available to a particular population and how that can help folks that are dealing with this circumstance. And one of the first things we want to address is making certain that we take care of the folks that are economically disadvantaged, and that includes helping people with the low-income subsidy program. You'll see that in many circumstances, the majority of these people are actually enrolled in standalone PDP programs, or about a third of them are in the MAPDs. Many times the folks that are in a standalone PDP program with a extra help benefit, the low-income subsidy that comes with it, those folks with the standalone PDPs make a great market for MAPDP programs as well, because they probably haven't been made aware of those options. So something to consider. When we look at the SEP for that particular population, it is one that has changed at the beginning of 2019, where prior to that it used to be a monthly opportunity. Now it is one that they can change one time per quarter in the first 3 quarters of the year, with the fourth quarter being handled by the annual election period. These folks have an opportunity for additional SEPs if they gain or lose that Medicaid or LIS status. And it's important to note that a certain portion of this population, if they're designated potentially at risk or at risk for the misuse of certain drugs, they won't be able to use this SEP code. This is in response to the opioid crisis for the most part, but most of the carriers also have a call-in service where you can determine if this is a valid SEP for the folks that you are dealing with, one, and two, if it's still available to them. If they've used it during the quarter, obviously you can't use it twice, but in the following quarter, they are eligible for it in the first 3 quarters of the year. The whole challenge that we have in many circumstances is making certain that we're doing the right thing, in a manner of speaking, and this is why some of these changes have been put into place, where these folks with the at-risk challenges, well, they don't want to exasperate that situation, hence the restriction that's put in place here. They still have availability to change programs through other SEPs they may qualify for, but not necessarily through the LIS SEP. It's important to note that overall, it's a subtle change for us that have been in the market for a bit. The biggest difference is, of course, the at-risk individuals and then the folks that have been auto-enrolled or have an opportunity to gain or lose coverage, and we take care of those folks as appropriately. So once again, this gives some detail on that, how it's a quarterly opportunity through the first 3 quarters of the year, OEP in the fourth, and then, of course, making certain that we take care of those folks according to their circumstances. Why should we be so concerned about this? Well, it's a big difference for this population. It's a big economic difference for them. And in many parts of the world, they aren't aware of the fact that they qualify for this help, and it can make a huge difference as to the quality of life. So first and foremost, we're doing good, but by freeing up some of that additional income, it may well give us other selling opportunities and other means of presenting programs that can help them in areas of need that they weren't able to afford prior to getting this assistance. So it's going to give people access to prescription drug coverage. It protects folks from that donut hole, the coverage gap that has been narrowed down, but is still a big drain on resources should someone hit that threshold. It does waive late enrollment penalties for Part D, so that's important if you deal with folks who didn't get in these Part D programs when they were first eligible or had eligible coverage at least. It does grant us that special election period, and by applying for the extra help programs, it triggers an application for the Medicare savings programs, which give them a whole new level of assistance with dollars coming out of their product, or out of their pocket, I should say. So important to note that we can really take advantage of this situation and help people who really need it because of, as we mentioned during the diverse population, those handicaps that come with dollars. To be eligible for these programs, the person has to have Medicare Part A and or Part B. You got to live in the U.S. and meet the financial criteria. There's an income test and an assets test in most states. Income test everywhere. Certain states waive the assets test. And there are some folks that are deemed eligible that automatically get this coverage, and these are folks that are receiving other needs-based benefits, so any kind of Medicaid or SSI or already in an MSP, they automatically get LIS and they don't have to qualify for it through a separate process. And this assistance gets the folks that help for at least the remainder of the calendar year. Folks do have to requalify each and every year, but this is a program that can help them throughout the calendar year and then moving forward. There are 2 levels of help for these programs. Keep in mind, these are what help people with their drugs. There's the full help, full subsidy program for folks that are of lower incomes and fewer resources. And then there's a partial subsidy for those that are slightly higher in income and assets, but still need help financially. These both eliminate the Part D coverage gap, and there's no late enrollment penalty for anyone with LIS being at full help or partial help at the time. For those that qualify for the full help, they take care of the Part D plan premium as long as they're enrolled in a benchmark plan. And these are plans that generally have a monthly premium between $32 and $33, a little bit, varies a little bit year to year, but that can be a big difference for them because they don't have the additional expense of the premium for these drug programs that are offered only through private companies. We see an indication of the fact that the waiving of the Part D deductible may be a clue as to whether or not someone has this already in play, but the standardization of the copays for the folks that qualify for this coverage are a true clue for us to realize that folks have this assistance and they may have that SEP available for us to help them change programs should it be appropriate. It's also a program that eliminates the copays when a person hits that third category of assistance in a drug plan where it waives the copays after reaching the catastrophic limit. These give you some detail as to what the levels of assistance are and how they affect the coverages. These come to us from the National Council on Aging, and they will be sent as part of the follow-up to today's presentation as well. So it lays out for you what a person gets with the different levels of assistance based on those income and assets. They are different for Alaska and for Hawaii. They're standardized across the other parts of the country where Alaska and Hawaii have higher income and assets tests available to them. Now, for those folks that have partial subsidy help here, it does help the individual with premiums. It's on a sliding scale based on the income. They lower the deductible to $85 from the standard deductible, and on a general program, it's a 15% coinsurance for the plan-covered drugs, and the copays are different. So keep in mind, in each of the circumstances, full help or extra help on a partial basis, these assistance programs and that out-of-pocket cost override the program that they're in, the dollars that are demanded through that program. So the difference is picked up through the low-income assistance extra help plans. These give you an idea then of the folks within these categories in Alaska and Hawaii as well. You do have some help on explaining these programs through multiple sources, but the Medicare and You YouTube recordings can really help as a third-party influencer and make certain that the folks realize you know what you're talking about. These are available across the board, but this particular one in different categories by CMS, but this particular one addresses ways that folks can save money on their Medicare coverages. And they have one particularly helpful as well for the Medicare savings programs. Why do we spend time with Medicare savings programs? Well, there's a ton of people that fit that qualification, and this market has not been as heavily penetrated as other areas within the Medicare Advantage world. 8.8 million people are enrolled in 4 MSPs, but a significant number of eligibles haven't been enrolled. And the enrollment rates will vary significantly from state. You'll have some where only 25% of the population is eligible in one. You'll have some states that, 78% of the folks are already part of an MSP program. Why would we care when this helps with a whole bunch of the other circumstances? Well, the assistance that people get in a Medicare savings program will vary according to which MSP they're eligible for. These are programs that are Medicaid administered programs. They help cover Medicare premiums and cost sharing on medical processes. LIS is drugs. MSPs deal with the other portion and roll in the LIS as we've discussed. These programs are known by different names in some states. It's called lipstick on a pig in a manner of speaking, but it's important to know how these are designated in your target markets within your states. The programs that we deal with mostly in these 4 programs are the top 3. So you've got the qualified Medicare beneficiary, the QIMBY, where this program helps people. It pays the Part A premium if it's applicable, if they don't have enough quarters in there, and the Part B premium. It also pays parts of the Part A and Part B deductibles, co-payments, and or co-insurance. When you get beyond that to the SLMBs, the specified low-income beneficiaries, and the QI1 individuals, those folks, when they qualify for that MSP, they are getting help with the premiums on Part B only. So there's a significant drop-off as to the benefits that a person receives by these different categories. But if you look at it in a manner of speaking, if a person's income is low enough to qualify for a SLMB or QI program, Q1 program, that Part B premium, when it's subsidized by these programs, can make a huge difference into the quality of life of these individuals. And these are folks that make great prospects for MA programs. The QMBs tend to be a DSNP opportunity, where the low-income folks that are slightly higher income, when they get that Part B subsidized, they have a different mindset in many cases than a QMB or a full Medicaid individual, and it can make a big difference as to how you can market other programs to those folks, because they don't have the same entitlement mentality. Don't mean that wrong, but it gives them additional dollars to spend on other programs in areas of need that they've recognized and that you can now help them with by income substitution. The benefits of these programs, well, as we mentioned, we hadn't mentioned yet, but it would waive the Part B late enrollment penalty if it comes into play. There's no estate recovery for these, so it's different than Medicaid programs that folks will spend down to get institutional assistance. And it also helps them automatically get the Part D LIS, as we've talked about before. These are programs that work hand in hand with different regulatory bodies, where CMS and the states work together. CMS will oversee the program, provides matching funds for these programs for the first 2, and gives the 100% of the cost for the through a block grant, easy for me to say, for the QI program. The state Medicaid agencies administer these programs. They determine eligibility. They pay the Part B premium. So it basically is subsidized, and their Social Security check goes up for that. Or if they are paying their Part B premium separately because they're not drawing Social Security, they'll see that big change come about as well. And then it pays those additional medical costs subject to the qualification on a QIMBY status, and of course the QIMBYs as well. The QDWIs is a category of under 65 disabled that are back working, and that goes up to 200% of the federal poverty level. You don't run across them very often at all, so we don't spend a lot of time talking about them individually. When you look at the history of these programs, they were put into play with different pieces of legislation throughout the years, and you will see that even the program that's been in play the longest, the QIMBY program, the Qualified Medicare Beneficiary, there's still over a third of the eligibles that aren't enrolled. So it's important to know how you can help these people get the assistance to not only improve their situation, but generate an SEP to help them change their coverages should it be in their best interest. Who's eligible? Well, they got to have Medicare Part A. They got to meet the eligibility test, both the income and assets where applicable. Note this gives us the detailing of the 8 states that waive the resource test. So it's based just on income. So Alabama, Arizona, Connecticut, Delaware, Mississippi, New York, Oregon, and Vermont, and DC have eliminated that part of the program. These applications are submitted through the Medicaid agency. Many times they are located in Social Security offices, and we know that those offices have some, well, they're not open now, but there are opportunities for you to help them online with that circumstance as well. And then, of course, the LIS application can be done through socialsecurity.gov. You can do that and help people compliantly as a advocate for that individual. And both of these pieces that come into play, we have pre-recorded webinars that will come to you as well that deal specifically with MSP and LIS programs and how that eligibility is redetermined each year. The limits when it comes to the incomes, well, here you go. In the continental United States, to qualify for this assistance, it's at 100% or lower of the federal poverty level, with resources at assets test being $7,860 if a person single, $11,800 if they're married. This gives the person a great amount of assistance, as we talked about as well. Alaska and Hawaii obviously have slightly higher limits because of the cost of living in those particular areas. So when you meet an individual and you've gone through some of their needs, you've done a fact finder, and you may discover that there are financial challenges, making a person aware of the fact that there are assistance programs at a specific level and discussing them from an overview can help you determine if a person should really apply for additional assistance. Oh, I have that one. I like that one so much that it's in there twice. No, this is the SLMB coverages. And what you see in this area are folks that are at 120% of federal poverty level or below. Same assets test as what we had with QIMBY, but these programs then will help people with the Part B premium. We see that the income of these individuals is higher, obviously, if you go to 120% of federal poverty level, and you have the same differentiation when it comes to income between your single and married individuals. You'll notice that it's basically $448. You got a little bit of the marriage penalty that's involved there, but it can make a big difference still for a couple. And as before, slightly higher limits for Alaska and Hawaii. The QI1 individual, this is also a circumstance where the Part B premium is covered, but these folks, to qualify for this assistance, it can be up to 135% of federal poverty level. Same assets test that come into play with the other two categories. And once again, Alaska and Hawaii have slightly higher limits. I'm going through these quickly because you'll get a link that goes through these in detail as well. So what you have also is a circumstance some folks will run into where there may not be a Medicare Advantage program available, or they are speaking with someone about a Medigap program and they discover they have Medicaid. Well, if someone has a QIMBY assistance program, they should not be sold a Medigap policy, and that can get you in a little bit of trouble, to say the least. For the other two categories, the SLMBs and the QIs, it's important to note if that additional assistance given to them for their Part B premium can help them afford a Medigap policy, and it can make a big difference. Now, for folks that have an MSP and are getting long-term care Medicaid, this is a bit different for folks because many times an institutionalized individual may not be a good prospect for a MA program unless perhaps they are eligible for an institutional SNP. We'll get into that in a little bit as well. This gives you the dollar amounts in a document, once again, obtained through the National Council on Aging that lays out these differences for you, specifically not only the income limits, but what they get with those different assistance programs. This dramatically shows the difference between the QIMBYs and the other two assistance programs. It gives you more ideas about the QDWI program as well. As I mentioned, you don't run across that all that often. Many times when you work in this arena, some folks will fixate on Medicaid assistance, and these are folks that are well under 100% of federal poverty level, so a different level of assistance from an MSP altogether. It's important to note that those folks are almost a little bit of a different market than you will see with the MSP people. So it's a market when you get into the slightly higher of the low income people, it is a different type of sales opportunity. Now, in many circumstances for a DSNP, to qualify for these, obviously someone has to be eligible or entitled to Part A and enrolled in Part B. They've got to qualify for the assistance, and this is normally of an MSP program, but most of the DSNPs require that to be at least a QMB or QMB1 program. So the SLMBs and the QIs don't qualify for a DSNP at full benefit that you would see with some of the other individuals. That can vary, however. There are certain DSNPs that even if a person is a partially eligible, not a full eligible with a QMB or below, some states and in some areas, certain carriers will grant them full benefit on a DSNP, even though they don't have full qualifications. Most plans, however, rely upon the Medicaid assistance to cover certain deductibles or co-insurance or co-payments that are part of their program, and so it's important to note that difference. And it's another eligibility factor for this is obviously they have to reside in the service area of the MA plan and at present not have end-stage renal disease. There are some exceptions for this because there is a chronic SNP program, a chronic special needs program in certain markets that specifically address ESRD, but it's important to note going into 2021, the end-stage renal programs will be, that requirement will be eliminated. So folks with ESRD will qualify for MA programs moving forward. How different carriers will handle that? Well, we're just learning of that today. There's a carrier rolling out 2021 benefits to us as we speak. I kind of have that muted on a different channel, so to speak, right now. But you'll see that different carriers will address this differently in different markets. So it's important to note that when a person applies for a DSNP program, this is a dual special needs program. Got to remember to speak to my acronyms as well. The coverage begins the first of the day after the month when the application is submitted in most circumstances. When you deal with some folks that are coming out of the health insurance marketplace as well, these folks, even though they may be eligible for Medicare, may have not entered into that coverage based on the fact that they're still employed or they're garnering coverage through the marketplace. Keep in mind, people with Medicare are covered and they don't have anything to do with the marketplace if they're already on Medicare, and that Medicare Part A and the MA plan qualifies as minimum essential coverage. So we're going to see a lot more play, I feel, in this area because the working aged, as some folks are referred to over the age of 65, may now have lost employment and lost coverage through the marketplace because their Medicare, they're applying for it now. They may be a significant piece of activity for us here in the next few months. We have a presentation on Medicare in the marketplace as well that will come to you. When we look at the special needs programs that are available to us, because in many ways, these are the programs we use to address the opportunities for SEPs. These are based on different circumstances, different pieces of legislation. We started clear back in 2003 with the Medicare Modernization Act, have been reassured through consequential legislation after that, and they are a type of Medicare Advantage plan that generally have a fixed network as part of them. They limit their membership to people with specific diseases or characteristics, and they tailor their benefits to address those needs of those specific groups. There are 3 categories of special needs plans: the chronic special needs programs that are based on the other qualifying factors we have with MA, and then the person having an identified health condition that is verified by a medical professional. And when you look at this and you see these different health circumstances, just because they are an eligible category, it doesn't mean that they're available in every market. And some of them may not be available at all. We find that certain chronic SNP programs may have been available in the past and aren't available now. And you will see these come available and come out of availability in certain markets too. What we're seeing, however, right now is a greater emphasis on these programs and a wider availability of them across the country by more and more carriers. Not every carrier offers them. Not every carrier puts the same emphasis on these programs, but it's important to note that they may be available to you in your market. We have a specific training that helps you identify them, and that will come to you as part of the follow-up as well. The institutional SNPs are what are available to folks that may be living in an institution like a nursing home or require nursing home care at home. This is a category that basically for the independent broker may not be a huge influencer, and don't get too upset about it because the network for these are generally the location of that institution only. And for most circumstances, these are not available for brokers to sell. Generally, the carriers will set up a captive or representative for these programs, and it's a longer sales cycle anyway. There are certain programs that are made available to brokers who have qualified to offer these programs. So if that's something of interest, we need to work with you with the carrier that is offering that program in your market and how you may be eligible to sell it. And then, of course, the dual special needs programs. These are for folks who have both Medicare and Medicaid that we've referenced a bit briefly already. C-SNPs, to be qualified for a chronic special needs program, the individual must have or be entitled to Part A and enrolled in Part B. They have to have specific chronic conditions and have that condition verified by a physician within a particular time limit as well. You got 60 days for that to happen, or they'll go back to original Medicare. They've got to reside in the service area, and they can't have end-stage renal disease unless that chronic SNP is set up specifically for ESRD. It's also important to note that This SEP comes into play for each of the qualifying underlying health conditions. So if a person, as we mentioned earlier, has those 3 different chronic conditions, part of the makeup of the Medicare population, well, they may have 3 different SEPs if there is a plan available for each of those conditions. These coverages do begin the first of the day or first of the month after the application has been submitted. When we look at this, you have at least 80% of the older adults have at least one chronic condition. Is it one that qualifies for this plan? These plans? Maybe, maybe not. But 77% have at least 2. And remember, going back, 2/3 of them, 66%, have 3 chronic conditions. So it's a pretty widely available program where the plan is coming into play. So when you look at these commissionable sales opportunities, you've got the C-SNP opportunity, you got the aging in folks, and those dual beneficiaries. These are the folks that we see most commonly available across the board for a SEP and not just for a SNP program. So it comes into play. I think the largest one we see outside of that is the move, where a person's moving from one area to another. And we will see, obviously, changes in how often a person accesses a SEP now because of the COVID situation. We can find out where these all lay through the use of Medicare.gov. As I mentioned, we have a link to specific trainings for these as well. When you look at these different opportunities with SNP plans, it's important to know that there may be multiple SNPs available in one market. How do you differentiate between the different programs? Well, it's important to know the plan and the network. Network is crucial. It's also important to know the details on these other assistance programs. Star Plus, as listed here, is the managed Medicaid system in Texas. Those are available in a multitude of different states. Managed care programs now, greater and greater availability. We don't sell Medicaid programs themselves, but it gives us the opportunity to market a dual special needs program. These programs generally require a longer appointment for explanation and making certain that folks understand the good, the bad, and the ugly of them. And having a SEP program, well, it can work both ways. You can enroll people, but if it's a multiply applied SEP, like the quarterly dual special needs program, well, people can be taken off your plan with it as well. So that's why we need to make certain that we're thoroughly explaining the advantages of the program and how you are the representative for that individual. It's also important to work with all the decision makers within that appointment. Many times that's other family members or other people of influence. Because there are differences in these programs, when you contract with a carrier that offers them, it's very important to attend their trainings to know what differentiates them from their competition. These are available through webinars and, when circumstances change, face-to-face trainings as well. And since you have a marketing opportunity here, it's also important to be aware of both the carrier and different pieces of marketing support that are available to you to help properly approach this population and help determine the value of these programs to the people you're visiting with. When you look at some of the differentiating factors, particularly in the SNP programs, look at all the extra benefits and how that can help your particular client in their particular circumstance. Is it one that, while they have challenges with transportation, well, the transportation benefit available in many of these programs can be very helpful then? Are the other benefits that are coming to play more in a special needs plan than in a regular MA program that help with social determinant of health benefits? That can make a huge difference as well. It's also important to note we need to be very aware of all providers that the prospect or client is accessing. That includes not just the doctors, the primary care specialists, or the hospitals, but then, of course, pay particular attention to the DME, durable medical equipment providers, if they're being accessed, and the home health care people. Because if they are not part of the program, they have to be part of the network as well in most circumstances. It is a challenge to our persistency if we don't properly address how those benefits are and needs are being taken care of by the plan you're enrolling in. There are carriers that are better than others when it comes to supporting DSNP marketing opportunities, but that carrier support can go beyond feet on the street or local access or different trainings. It also may be a co-op opportunity with certain carriers as well. And it's important to note that in certain trial states, there are Medicaid managed care programs that are implemented in a state. They're called MMP programs that are a dual effort between the federal government and the state to offer a single program to those individuals. And that may not be as widely spread in some states as others, but if you run into that circumstances, a person who has that program, well, it's not a commissionable type of circumstance. You can't even offer it. So it's important to know how those come into play. In Texas, that's a whopping 6 of the 254 counties in the state. Some other states have different requirements, so it's important to be aware of them and how they can work with you and against you. So a lot of additional access here for other resources that are made available to you. But keep in mind that these are there, and these are live links for you as well. Some additional pieces that are in there, and there are additional marketing material pieces available through the government if you know how to get them. So look at this category and the product ordering pieces. It's not intended necessarily to be widespread marketing material for an agent. If you go in there and try to order a whole bunch of Medicare and You books, you get squashed on that pretty quickly. But there are other neat pieces in there that can help you market, including up to 50 calendars ordered at a time, different pieces that can come into play that can really help you not only gain knowledge of this area, but also help you market. When you look at Medigap policies, keep in mind these are different as to how they are, well, the oversight they're subject to, where you have MA programs that have those specific steps that come into play. Medigap doesn't. If a person's on an MA plan, you need to have a SEP to take them off of it. But the marketing of a Medigap program, a Medicare Supplement program, someone who already has it, well, that's not a concern. It's a question of then, are you able to get that person through underwriting first and foremost, or are you residing in a state that may have different guarantee issue periods than some of the others? There are certain states that have a birthday rule. There are certain states that have different standardized benefits. We really need to be aware of those circumstances based on where you are. And we have, of course, another training that helps you do that. When you're outside of the open enrollment period, this is where in most circumstances you see the need for medical underwriting, and those qualifications can change if that person's been initially enrolled in a Medigap policy called Medicare's a Medigap Select policy. These are programs that don't have a network, but in order to get full benefits for hospitalization, there is a designated site, a designated hospital system that helps in that regard. There are a number of reasons why someone wants to change a Medigap policy. We're mostly aware of the fact that a lot of the folks, they shop for cost. And we have some tools that can help you do that for these individuals through our quote engines that not only give you an idea of the plans that are available in a market that you should be contracted with, but how those programs can help your prospecting clients as well. You don't see too much of a need, or you don't see too many people requesting a change because they've got too many benefits. You'll see some folks that may have selected like a plan N and want to go to a plan G or an F if they're eligible for it, because it has more benefits. But that's something that you'll run across as you are more familiar in the Medigap market. Some of you are probably well versed in that anyway. You don't see a lot of people that are changing their Medigap policy simply because of the name of the insurance company, but you know how that works sometimes. There's also opportunities if you are dropping or losing Medigap coverage. You don't see a lot of these Medicare supplement programs go under financially. It could happen, but you have the states that will come in and help make that person whole as well and help them get additional coverage. You'll see that the Medigap policies are standardized. They have gone through a number of different segments of legislative oversight. Back in the day when my grandmother was still around, and I'm a little older than I care to admit now, at one point in time before they standardized these programs, a person could have multiple med subs. Now you can't. Now companies can only sell the standardized, modernized programs, and they have basic benefits that come into play. And as I mentioned before, the standardized benefits are the same in all states except for Massachusetts, Minnesota, and Wisconsin, where these Medigap policies are standardized in a different way. So if you're marketing in one of those states, you need to get you specific details on how they operate if you're not already well versed in that area. There are important differences as well, where the carrier doesn't have to offer every available Medigap policy. They may choose to concentrate on marketing just certain types, but they must offer a Medigap Plan A if they offer any other Medigap policy. And they must offer CNF if they offer any other plan to folks that are eligible for that. I keep saying that because we're going to address MACRA here in just a moment. That will then change for folks that are eligible for Medicare after the first of this year, because Plan G then comes into play. When we look at MACRA, this is legislation that was enacted clear back in 2015, had just come into play on the first of this year. It eliminates the possibility of someone who is eligible for Medicare now accessing a C or an F plan. But those plans aren't going away. We're actually seeing some active marketing within folks that have Plan C or Plan F to look for other programs, that's a C or an F, that may be more financially feasible than the one they're on now. That isn't the circumstance for someone who's just gotten Medicare after the first of this year, but there's a ton of material available through different carriers that offer these programs. These links actually go to Aetna's take on MACRA. What we see here is how these plans then come into play. What's available to your prospects and clients based on when they begin accessing Medicare. Very helpful chart. That tool that I mentioned that helps you determine what plans are available and where is complimentary to our contracted agents. It's a CSG product that will give you a ton of information across the board and can actually also help you cross-sell. Surprisingly, they have a webinar for that cross-selling piece as well. You'll see, however, in this quoting tool, a number of different products. The only one that you couldn't discuss during a Medicare appointment that's been put into place with a scope of appointment, and you'll notice you can access that electronically through this tool and store it here for those required 10 years for the appointment, whether you sell it or not. It gives you an opportunity to fill the holes in Medicare Advantage plans that they may not have a SEP to change or they're satisfied with. Keep in mind, you don't necessarily need that scope of appointment for the Medicare Supplement folks, but generally when you're on a Med Sup appointment, they'll ask you about the Part B drugs. So having the scope beforehand can make a great difference to you in the latitude that you have with selling. And the only plan you can't discuss that's part of that scope is final expense. When you garner interest in that product through that initial appointment, it would require you to exercise that 48-hour cooling off period and coming back afterwards. Now, if you're going out on a final expense product, you completed that sale and someone brings up the additional need for the base health coverage or some of the ancillary coverages, MA or PDP, you can then create that scope then and move forward with that, not vice versa. And keep in mind, you don't need a scope to market dental or hospital indemnity or a chronic program such as those for heart attack, stroke, cancer. But that is part of the scope of appointment document, and it helps you transition to those discussions after speaking to the underlying source of the initial appointment with the base medical coverage. So it's important to remember, we don't want to put all our eggs in one basket and that one size doesn't fit all, but you got a ton of information out there that helps you verify what you're talking about. Third-party influencers through CMS. This addresses the plan finder that changed this past AEP, but it's a great tool to lay out all the programs that are available, and it lends to your credibility and knowing how to do that. But we also have our Medicare Center program that is available additionally from the CSG quote engine. This deals with MA and PDP product. It's available to our contracted agents without cost, and it gives you the opportunity to do some things remotely. Sending out the scope of appointment, storing it is also available in this program, but it also gives you an opportunity to compare up to 3 programs for an individual, get them that information, lay out all the detail with the underlying documents that individual needs to discuss these programs compliantly, and then enroll them through a number of different factions as well. Surprisingly, hey, we got a webinar talks how to use Medicare Center as well. And it's important to note that as we go through and talk to folks and we reveal the opportunity they have to address their coverages throughout the year with the SEP, that doing so through a fact finder and speaking to the individuals about their circumstances allow us to sell additional product to help address those needs. And the more products we have in the house, the better our retention is as well, our persistency. And it drives down our cost per acquisition. Some of the things that you'll see as well that are available through us, you can create an agent profile in this software package through SuranceBay and contract with multiple carriers electronically. Not all carriers work with this program, but most do, and it gives you a great opportunity to contract with multiple programs without having to complete a whole bunch of real paperwork, all done electronically, auto-filled for you. There may be certain circumstances if you're looking at just a specific MA carrier, utilizing their electronic contracting may be faster, but that's important to note that you have the opportunity to contract with multiple organizations easily through the software program. As an independent agent, we do discount E&O to qualified agents. What's a qualified agent? Someone who's got a contract with us. But as an independent agent, it's important that you protect yourself financially and your organization and your assets. This does that. You have an opportunity to use it at a discounted rate for premier carriers only, but for a slight increase in premium that allows you to cover yourself with all carriers, regardless of who you're contracting through and for what type of product. So that's really important in covering a need for the independent agent. And we also help you do that same thing in keeping your license in play with bundled CE credits, continuing education credits that keep your license in play. And we do so through our relationship with WebCE. We also have a program here that helps you improve your own benefit package that you are paying for as an independent agent. This is a program that gives you DI coverage at a modified guarantee issue on a modified guarantee issue basis with discounted rates where you share in the commission as well. We do, as I mentioned before, record a lot of different presentations, keep referencing them through the course of this presentation. But they're available for you 24/7, either through our website at Premier SMI or through our YouTube channel. They address not just certain products, but also different marketing opportunities and how to get in front of folks as well. Coupling that with these online enrollment programs, it gives you an opportunity to be prepared and an opportunity to work efficiently through programs that can cut your windshield time, make you more aware of the different opportunities available through different companies, and do so efficiently. Once again, utilizing that electronic access through CSG. There are e-apps available in that if you hadn't noticed as well when we went through that section earlier, and through the Medicare Center program. We do bundle the information on our website as well to make certain that you're aware of all the compensation that is available to you. Keep in mind when we talk about SEPs, generally that means we're talking about Medicare Advantage and PDP programs, and the compensation level for those programs are set by the government. They don't help you qualify for any type of trips or additional incentives, but they also can help you qualify for the Premier Producers Convention, which this year was going to be a cruise from Miami to the Bahamas. Obviously, that was canceled because of our certain circumstances. Next year, information still to come. We do help you with certain lead programs as well. If you are one of the cold callers, but you like Ma Bell, can't cold call for PDP or MA programs, but you can for MedSup. We can help you with call lists for that. And we can help you work through different community-based marketing programs as well. Retail marketing is a very hot topic, particularly during open enrollment. We are in another round of selection for the Walmart folks and the carrier-specific retail program. The little details are just still coming out. So there's opportunity to work in these different dispensaries, in a manner of speaking, of prescription drugs. We also have a program that helps you approach faith-based opportunities and other centers of influence in your community, and how to market to and through providers. Shocker? Got recordings of those as well. Certain carriers do generate prospects for you too, particularly if you're working the DSNP market now. Some of the carriers may be more open to helping provide leads for you. Not across the board, and generally those are first come, first served for folks that are producing with those carriers presently. We do offer internet leads as well, and still provide direct mail support. Those internet leads, they're available for both final expense and in the Medicare category. Yep, we've got details on that too through recordings. And the direct mail support is a subsidy of a part of the cost of the direct mail based on production per month. There's one program like this for Medicare products. There's also another program like this for final expense. Two separate programs, so you can kind of double dip in that regard. There's also a newly introduced direct mail support program where you're buying on a per lead basis as opposed to a mail drop. So this has just been rolled out. Additional details are available to you upon request. All that said and done, we're well over the hour. I apologize for that, but you got a lot of information in this program. We're looking for an opportunity to work with you. And it's a determination on your part as to whether or not the carriers and some of the other support we have can make a positive influence in your own personal marketing program. If it does, as John Wayne said in the Cowboys, we're burning daylight, let's get on it. All that said and done, you can get additional information about any of our programs through our toll-free number at 1-800-365-8208 or at our website at premiersmi.com. We look forward to those discussions, but let's check and see if there are questions that are coming up here. And it's a reminder for us to say, of course, that you are going to receive the recording and much of the additional detail we've discussed through these programs. Question, ESRD will be eligible for Medicare or MAPD plan in 2021? Yep. Details coming out on that. We'll have a further explanation of that as part of the follow-up too. Changes for DSNP. You don't see a lot of changes in the plans themselves. You are seeing greater availability of DSNP programs in many markets through more carriers. So that's a change that comes into play. You are seeing additional scrutiny on certain plans they refer to as look-alike DSNPs. So if you're involved with those, you'll know it. And it's important then to be aware of how that additional oversight may affect how you market. And it appears that that's the bulk of the questions that we have. So I want to thank you for the time that you've invested with us here today. Watch for the follow-up. Look for conversations with your marketer within Premier. And in the meantime, we wish you good selling. Thanks so much, and we'll talk to you soon.